Hi, I'm Andrea. I'm a senior, and I am checking off Suki, and I am starting the timer now.
Okay. Okay, so I'm just gonna, come on, Suki. I'm just gonna look at you and say that obviously your head is normal cephalic and it's on the midline, symmetrical. Can you smile for me? Okay, that's good. So your face is all working symmetrically. Your nasolabial fold is even and symmetrical. Your skin is free of lesions, and I can your neck and see that there are no apparent, obvious carotid pulses or JVDs, so that's good. And can I touch your hair?
Mm-hmm.
Okay. So just tell me if you feel any tenderness. There are no unusual bumps or lumps. No sign of infestations. No step-offs. That's good. And the patient has no unusual lumps or bumps or tics, or unusual movements that you wouldn't expect to see. Okay, this your temporomandibular joint. Can you open your mouth? Okay, and close it. Any pain there?
Mm-mm.
Okay, that's good. And there was no sign of crepitus, so that's good. So I'm going to push in your sinuses. So your maxillary sinuses here. Any pain there?
Nope.
Okay, and your frontal sinuses?
Nope.
Okay, so I'm here in the back. I'm going to check out your occipital nodes. And I can't find them, so that's a good sign. Your post-auricular and your preauricular nodes. Your submandibular, sublingual, and submental. And I can also look at your, you have two triangles in your neck, where we divide them into two triangles, and they're separated by your sternocleidomastoid muscle. The anterior triangle is formed by the trachea, the sternocleidomastoid, the mandible, and the trachea, and in there you can palpate for the anterior cervical chain of lymph nodes. And the back triangle is the sternocleidomastoid to the clavicle, to the trapezius muscle, and you can feel for the posterior chain of cervical nodes, which I can't feel again, so that's good. And then your supraclavicular ones are right here, so super means above the clavicle, and I can't find it in there, so that's a good thing too. And then right around here, I look for your deep cervical chain of lymph nodes. I can't see those either. So, can I have you swallow? Okay. So the trachea rises and falls on the midline, so that's a good sign. And a little cuffs. Probably should look for that ahead of time. Okay. Are you okay swallowing a few times?
Mm-hmm.
Sorry.
That's okay.
Okay, so I'm going to put my hands on your trachea and have you swallow again. Okay, so the trachea again rises and falls in the midline with no evidence of tugging, so that's good, because if there was tugging, we'd be concerned about a tumor, which would be pulling it down, but didn't find it, so that's a good thing. Okay, and then I'm going to, can I have you stand up real quick?
Yes.
I'm going to look for your thyroid. So I'm going to have you look down this way a little bit, and come in and push. And there. Okay, I'm going to actually listen to it. And if you could hear something called bruit on a thyroid, it would be like rushing sounds, which would be abnormal because you don't usually have a lot of vascular stuff there, but a tumor on your thyroid would make a lot of vascular sounds, and you don't want to hear that. Okay, and I use the bell of my stethoscope. So, right here. Okay. And, sorry.
Mm-hmm.
There. Okay, and I'm also going to listen to your carotid pulses. If I can find this here. Okay, and then your temporal one. Okay. And on this side, check that one. So, carotid pulse. Here. And then temporal one. Okay, good. So there's no bruise on any of those locations. Okay, I'm going to test your cranial nerve we'll start with cranial nerve number 5, which is your trigeminal nerve. You can test for sensation, that's what I'm going to do first. So if you close your eyes, all I'm going to do is touch your face really lightly and have you tell me when you feel me touch it. Okay?
Yep.
Okay. You can close your eyes.
Okay.
Sorry, I won't poke you, I promise. So.
Okay, I feel it.
Then the other half of the trigeminal nerve is movement. So can I have you clench your jaw? And then open it side to side. Push against my hand. Good. Okay, good. And then the other cranial nerve we'll look at right now is number 7. I already said 7. Cranial nerve number 5 is the trigeminal. Cranial number 5 is the trigeminal nerve. Cranial nerve number 7 is the facial nerve. And to look at that, I'm going to have you do some funny things with your face.
Okay.
Smile. Okay, good. And frown. And then puff out your cheeks, like, yeah. And then make a fish face. Okay. And then close your eyes really tight. I'm going to try and pull them open, so keep them closed. Good. Okay. And then raise your eyebrows. Perfect. Okay. And then last thing now you do is just follow me. So you're going to extend your neck forward. And then up regular that's flexion. And then that's flexion. And then that's extension. And back hyperextension. Okay. And then you're going to laterally rotate it. Okay. And then to the other side. And then laterally bend it. Okay. Cool. And then you're going to go one more time and push against my hand. Push against my hand this way. Good. And then back. And then to the side. And then try and turn it. Good.